All right, well, it is 2 o'clock. We're going to go ahead and get started. Thank you, everyone, and hello. Thank you for joining us today. Welcome to the Center of Excellence for Behavioral Health and Nursing Facilities virtual education event. Today's session, we will cover Substance Use 101, the ifs and what ofs substance use disorder basics. My name is Rukia Campbell, and I am the technical support for today's session. So before we begin, we just have a few housekeeping items to get us started. First of all, this session is being recorded. All lines are muted, so please use the chat feature to ask any questions. If we are unable to answer your questions during our session today due to the question having a more vast topic relativity, then we will be sure to make note of your question and follow back up with you. If you haven't already, please complete the pre-test survey. We are going to put a link in the chat. So the link is now in the chat. And you can either click that link or scan the QR code. And great, thank you, Leah. She said the QR code works wonderfully. Perfect. As we near the end of the webinar, there will also be a post-test survey that we would like you to complete as well. And we thank you in advance for your participation in that. Now, we couldn't host events like this without our hosts and our presenters. Today's presenter is Diana Padilla. Diana has worked in the behavioral health industry for more than 24 years, and her vast experience includes service provision to diverse communities with substance use, HIV, HCV, trauma and stress, and other psychosocial conditions. In her capacity as a research project manager, she develops curriculum as a senior staff trainer for the Northeast and Caribbean Addiction Technology Transfer Center. Diana's areas of expertise include culturally and linguistically responsive services, trauma-informed care, community disparities, racial stigma, social determinants of health, and more. Also joining us today is Nikki Harris. Nikki is the Center of Excellence for Behavioral Health and Nursing Facility Training and Education Lead. And now I'll turn it over to Diana as she begins the presentation.
Thank you, Rikia. Thanks everyone for being here. So let me just start off by saying, well, thank you for the work that you do. One of the hardest disciplines to work in is in the nursing home, in a nursing home setting, and so many different variety of capacities that you serve. And I know you're tasked with a multitude of different responsibilities, which doesn't get easy because the care that you give to the different patients or residents that you have tend to be complicated by certain health issues. And some folks have more than others. And with all the hard work that you all do, one of the hardest things that that you also have to, that you're encouraged to deal with is being able to recognize substance use issues with clients, which can make caring for them that much more complicated. What's interesting about the substance use is that it can be very, very elusive. And so we would like to at least start to bridge some of the gap in the information that you get that can help inform how you go forward. And so we start with this. And so I'm here to talk about substance use and just how common it is and how it relates to the work that you do in your settings. And so right now, what we know about the prevalence of substance use is that more than 40 million Americans over the age of 12 had reported a substance use disorder in the past year. And this is one of the more recent annual reports that have been put out. And there was almost like in 2020, there was almost like 59% or maybe 100 and I think it's 162 million plus persons who had used some type of substance, whether it's illicit or legal, it was tobacco, it was alcohol, overusing medications and that. And so it doesn't always look very obvious. So some of the prevalence also includes that these folks who have used and say in the past month or when the survey and this data was collected, there's almost 140 million people drink alcohol. And alcohol has a lot of different implications for different health issues. And not that the many people in our communities tend to know that, that's more something that's more relevant and more known by professionals like yourselves. And so 51% of million people who had used tobacco product, almost 38% used illicit substances, and the list can go on. This is just to kind of like give us an idea, somewhere to start off of. I like a baseline. So the impact of substance use, the way it relates to what you do is thinking about the communities that you serve. And I've only got a couple of communities here. And so we know that the seniors, I think it's the largest largest aging birth cohort we have ever had in this country. And so when you have seniors as residents who need long-term care and have different health-related issues, as well as medical issues and maybe medications that they're taking, the use of substances or substance and alcohol, can create a lot of different complications. The interactions of chemicals, how it can further impact existing medical issues. With younger people, what we do see is that some folks may be recovering from an injury. And a lot of the data, and some of us are familiar with how communities may tend to overuse a particular medication that really was initiated from a health issue, an injury, so to speak. And so with chronic pain and with some of these medications that are given, there's a high risk for substance use disorder. And so we also know that it's overdoses in New York and New Jersey and across the nation have really risen since 2019. And so we're mindful that we may have some residents who may be dealing with recovery, who may be dealing with medical issues and the recovery process may be at risk, or who may actually find themselves caught up with the progression of substance use. Next slide. And so what I want to present to you first is substance use terminology. Next slide. And so I'm curious, and if you folks don't mind, and I know we're here for a little while, but it would be great if I can get your take in on the chat box. So just to make it slightly interactive, if you don't mind, I'm really curious. So when it comes to drugs or alcohols or substances, which terminology are you used to using, or do you tend to use within your profession, within your discipline, within your work? Do you use addiction or substance abuse or substance use? And I'm just curious to know which one you do use. So, very good. So, okay, so that's really good. All of them, interesting. Okay, so, and I know for some folks, there may not be a difference. Next one, next bullet. And so I wonder if you folks think there is a difference between these terms. And so think about it and then just put it in the chat box, and I'll continue to read them. Next bullet. Here's the thing. The terminology has been changing since the DSM-5 has been put on, and that was back in 2013. And so the terminology has changed where it's less of terms that are stigmatic, and that's what we're getting from the field. And so we are changing or encouraging practitioners such as yourselves to actually evolve your understanding and use of terminology for substance abuse to substance use. And I'm going to talk to you about a couple of different distinctions there. Because substance abuse has been such a stigmatic reference that a lot of the community members, and this is according to the data and surveys that have been facilitated, a lot of members of the communities have felt like they were being judged, or they were being stigmatized to a point where they weren't accessing care when they needed it. And stigma has been identified as one of the biggest issues, one of the top 3 that's been consistently identified having to do with folks not accessing care when they feel they need it. And so we try to stay away from substance abuse, even though that's what we were taught back in the day. And that was appropriate at that time. But just like you folks, how you evolve your skill sets and your competencies every time some new intervention or some new protocol comes out, and you get to evolve with that, and you learn it in your integrated practice, we do the same thing with language. And so with language, we're asking everyone to start to get into the habit, instead of saying substance abuse, substance use. The idea here is because when you do have opportunities to speak to your patients, especially when it comes around in reference to this particular topic, which is a very personal issue for any given person, you're more empowering when you're using like terms of substance use as opposed to substance abuse. The other thing is it's also a great way to reinforce it in our minds. And in our minds, our terminology reflects what we think, and what we think can be adjusted and evolved so it can be reflected in language. And that way we can also just increase our efficacy in interacting with our patients. So going forward, I'm going to use the term substance use. Next slide. So here are the different terms And this is, and I know there's not a lot of explanation for this, but I would tell you that there are distinct categories of substance use. So substance use is really simple. It's just the consumption or the use of psychoactive substances and different, whether someone is smoking, drinking, it's these are different things that folks take that may have a psychoactive property to it. Substance misuse is like using medications other than prescribed. So that's misusing substances. And that could be the most natural thing in the world for somebody to think about in their own home. If they're used to taking a certain medication for pain, now their pain is not as bad, but they still have some in their medicine cabinet. And then, I don't know, 6 months later, there's some kind of injury, something severe, a physical severity of pain, and they decide to go use what worked before when they were prescribed it. And then it's easy to get caught up, and very easy to get caught up in the progression of substance use. So substance misuse is pretty simple. It's just using it other than prescribed. At-risk substance use is very elusive. And so this refers to consuming at harmful or hazardous levels. And that just means, and when we're talking about putting someone putting themselves at risk of these hazardous consequences, is because they are drinking or using to a point where their impaired judgment is putting them in a position to get a DWI, to stumble over the sidewalk and fall while crossing over, or maybe they are experiencing some of these. And so that level of consumption is an at-risk level. But it doesn't mean that they meet the criteria of substance use disorder. That's why they're distinct categories. And that refers to the level of consumption. And substance use disorder is very specific and meets a criteria. Let's continue on. So here's the biggest question that folks ask. Why do people take drugs? And you can put your own comments in the chat, although I'm going to go through this, but please put your comments in the chat. Next button. A lot of folks just take drugs, you know why? Because they just want to feel good. That's it. Sometimes it's just to kind of take a break from the day. Sometimes it's something that they share with other people at the time. Maybe everybody's sharing a drink at the time. Maybe somebody's actually smoking a joint. Now, in a lot of places, this has become legal. So it's becoming kind of common rituals. And sometimes it's just a matter of feeling that sensation. Next slide. But sometimes folks also use it for other issues. And you may be more familiar with some of this because some of your residents may be dealing with the issues of anxiety, the issue, medical anxiety, depression, and other psychological disorders. And a lot of times has symptomology that the medication that may be available may present to them with more adverse effects than they're willing to experience. So sometimes folks will mitigate with substances, or sometimes there is anxiety, and it's not necessarily a disorder that was diagnosed, but it's really it's a situational issue where they are presenting with a certain amount of fear or trepidation because maybe they have to go to court, maybe they have to get a surgery, and so folks might take substances. Drugs is really whatever substance or alcohol or tobacco that may be out there. And then sometimes folks will take it just to feel better from feeling hopeless. Just think the alcohol consumption levels just rose phenomenally from when the pandemic first hit. Just that was like a coping mechanism for a lot of people, where at one time it really wasn't. And so there are different situations that can pull or push someone to want to use substances. The thing is, the other question is, why don't people stop? And this is where we want to speak to, at least for just to kind of maybe just remind you, if not inform you, of what some of these things, what happens with some folks when they do take substances to deal or mitigate symptoms or to be able to cope with situations. Next slide. So one of the things that's really important is like, let's just go back to school for just a couple of minutes. When we remember that the brain functions in very different ways, different parts of the brain is in charge of different functions in the human body, where I'm batting my eyes, where I'm breathing, how I'm thinking, all of that different parts of the body, all of different parts of the brain actually have to, They are in charge of different functions, but at the same time, they also have to communicate with yourself. One of the things I want to bring your attention to is in the temporal lobe and the limbic system, which is the middle part of the brain where memories are retained, experiences are retained, associated feelings and sensation are retained, that there, and then the front part of our brain, which is the prefrontal cortex. And depending on your resident, age-related resident, brain is not fully developed until somewhere between 25 and 30 years old for a given person. And even for a person who has a fully developed brain, the front part of the brain is how someone will make informed decisions. They can weigh out the pros and cons. It kind of, that critical thinking leads to informed decisions. And so that's what typically the brain does. How does it, but then it has to communicate with itself while it's doing, performing all these functions simultaneously. And so those two parts I want to make sure that I want to highlight. Next slide. So I wanted to tell you about the neuron activity. So let's remember back in school when we first learned about this, when different parts of the brain are talking to each other, what's really happening is on very, 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 very minimal microscopic level, we have some neurotransmission going on. And so you have different neurons that will transmit chemicals or chemical signals or electrical signals, it's really chemical signals from one neuron to another. Once that is received by the other neuron, a message is delivered. And so this is called neurotransmission. And so when neurotransmitters are working, they're all happening at the same time. Next slide. What we start to see is communication from the brain. And that's how the brain starts to incite different functions. And so neurotransmission kind of happens like this. What you see is the neurotransmitters, those little tiny little dots in between the end of those dendrites, which are like the end of the tentacles of the neurons of the previous image. So what happens is that those neurotransmitters will go into a space and then eventually connect to a receptor. So just imagine that there's a softball game and the pitcher throws the ball, the catcher catches it with a mitt. The ball is the neurotransmitter, and the mitt is the receptor. Once it catches, the message is received. And when that's happening all at the same time, the brain is communicating certain neurotransmitters to incite certain functions. Next slide. And so what we are familiar with is that dopamine is one of those neurotransmitters, very much associated with substances. It affects motor movement and it is involved in pleasure. Norepinephrine affects heart rate, blood pressure, sweating, dilates pupils and constrict blood vessels. Serotonin affects sleep and mood. So different neurotransmitters are incited for different reasons to achieve different goals. Next slide. And so what you see here is a positive reinforcement, negative reinforcement of the brain, the biology and motivation. So what happens is when the brain is used to doing things in a certain way, when you're hungry, when when you're thirsty, you want to drink. You learn that since infancy that to do that, to satisfy your hunger, to satisfy your thirst. Well, that brain and the limbic system, the mid part of the brain knows that. At the same time, that's associated with dopamine. Dopamine is also released from the middle part of the brain. It goes into the front part of the brain as well. And those sensations of satisfaction is what prompts that repeat behavior. Next slide. And so what happens with substances is that substances have a much more intense impact. They incite a release of dopamine and other neurotransmitters at such a high level and with such an intensity that the limbic system starts to remember and prompt that repeat behavior to continue to have that euphoric feeling, that sensation, or the no pain, because some people take substances to not feel pain. And what happens is that the front part of the brain doesn't have the capacity as much. It starts to be compromised in terms of being able to function, to be able to mitigate and make decisions like maybe I'm using too much, or maybe I should drink some more, maybe I should have a meal every once in a while. And so the natural reward pathway gets overridden and kind of hijacked by substances. And that's what happens when someone is into a point has progressed to a point in their substance use that even if they want to stop using, they can't. And so that kind of starts to speak to the science of substance use disorder. Next slide. There you go. Thank you.
Scientists first began to understand addiction as a brain disorder in the 1950s. Doctors Olds and Milner, in laboratory studies of rats, found the parts of the brain affected by addiction. But then in 1994, doctors Volkov and Shelbert, top neuroscientists, ran CAT scans of the brain that showed the effects of substance use disorders. Like other diseases, these scans showed it affected tissue function. There are two main parts of the brain affected by drug use: the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So when you do essential things to stay alive, like eat, drink, find shelter, have sex, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling, so we seek it again. This is our survival hardwiring. Addiction also affects this area up here in the prefrontal cortex, which is what separates us from other animals. This is where decision-making and impulse control live. When drugs or alcohol are used, they activate the same dopamine process in the survival center. And when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens this system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, sex, and protecting our young. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use. There are factors that put you at higher risk for the hijacker, including individual factors like genes and age of first use, and then environmental factors like drug availability. But if the hijacker takes hold, addiction is treatable. Advancements have been made in assessments, detox, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that once in recovery, the tissue in the limbic system and cortex can get better. With your help, we can expand these innovations to help millions of individuals and families and ensure that addiction is treated as the medical issue that it is. Together, we can solve this. Join us.
Thank you, Rakia. Let's go on to the next slide. This whole video is just is really showing you how at a certain point when chemicals take over the brain, the person's capacity to want to do something different is limited. Folks don't use substances, may use substances for certain reasons, but when the chronic use kind of takes over, their capacity to do different, especially on their own, is very limited if it exists at all. And so for a lot of folks, that's how severe and extensive can be the impact of substance use disorder for some folks. So this is not a choice. It's not something that somebody willfully does and keeps doing and doesn't care about everyone. There's a whole lot of changes happens in the brain. And this is the criteria for diagnosing a substance use disorder. And this is very distinctly for that category. And so what I wanted to show you here to make the last few minutes I have is, there are different types of substance use disorders according to the DSM-5, whether it's alcohol or opioid use disorder, which we're familiar with, but there's also stimulant use disorder, tobacco use disorder, methamphetamine use disorder, cocaine use disorder, and each disorder has their criteria for that level of for that type of diagnosis, which really speaks to different health issues and care. So let's go to the next two slides. So what's relevant for us, for you as practitioners in your setting? Well, the impact of substance use can look very different. It can really have play a huge part in how some folks have some of the issues that they come in with that they present in your setting. So some folks may have dementia, but it may be induced by alcohol. And that typically happens when there's an alcoholic liver involved, when cirrhosis has been substantially progressed. We have different stages of cirrhosis, and we know at a point, once it's past the point of compensation, being able to compensate for itself, the liver can go towards end-stage liver disease, and dementia can be part of that. There's also times when you have a patient that presents with gastric issues, and many times because our lens is so focused on what we do as a clinical nurse, as what we do as a physician, as we do in whatever capacity we're serving, we may not necessarily consider that the physical, the medical issues that you are seeing may not necessarily be connected. You may not consider that it may be connected with potential substance use, and you don't necessarily know that. So there's different ways that substance use can impact a person and further complicate the health issues that they're there for you to care for. And sometimes we do see some things like neglected appearance or problems with family and friends, and changes in how they interact with folks, and other type of issues. What I want to leave you here with is thinking about the language and when you do connect with folks, because I want to talk about the importance of screening, but using affirming language, and really not just substance use, but language that helps you connect with the individual, that the individual can feel like they're being supported. It's going to help you build receptivity to have a conversation with them, to be able to at least understand, where substance may have an impact in their life. So affirming language is really important, particularly for supporting someone's recovery and wellness process. And certainly you should always use a culturally informed or responsive lens with any given person, because everyone has their own individual philosophies, capacities, and limitations. And so that's important to go forward with. Next one. The language with them that we use with them really can help address stigma, because people in recovery from substance use and mental health disorders, along with other medical issues that you are caring for, tend to stigmatize them and really can impact their health outcomes. Next slide. So some of the benefits of universal screening for nursing facilities include faculty staff never know who is at risk unless they ask. And actually just asking a simple question is really about using a validated screening tool. But screening for folks, it's really the best way to understand if there's a potential issue to explore, and help to keep a treatment plan that much more accurate. It helps identify the persons who may need specialized care plan or may need particular certain types of support. Doesn't mean everybody's going to have a substance use disorder, but if using substances that are at risk level, it can certainly complicate how you're going to be able to be effective with them in their care. So it provides an opportunity for early intervention, for education, for treatment. And so it also helps the whole clinical team, starting with the physician, to understand what the risk factors are for interactions for medications and other recommended steps depending on their situation. The benefit is reducing the high-risk behavior for persons who are at risk. And for every person that meets a substance use disorder criteria, there's at least 4 to 6 people who do consume at risk levels. Next one. And so here, what we want to kind of just speak to is the patient-centered care is essential. And so meeting somebody where they're at, it's not just the medical, it's the same concepts that you use to address specific medical issues with a person that takes specific recommended steps. It's the same idea when you're engaging someone around substance use. And so it all kind of speaks to eliciting their understanding of what's going on with them, and being able to integrate their own commitment to their own wellness process, and collaborate with them to help them around their substance use. Next slide. And so I just want to finish with this prevention tips that we want to offer you. Education, awareness, and recognizing the signs that someone may have substance use disorder or at-risk substance use can prevent the adverse consequences, especially when you're giving medications, not just giving the care, but even the medications that you're giving. So be supportive. If you think someone needs help for substance use, notify the team. Let them know that that there's a potential issue, so that way you can screen and then be able to to address it from there. Language should be conducive and very much empowering and inspiring for folks and recognize that people with at-risk substance use or with disorders have other medical conditions that are in your facilities. And what that does, it just complicates the care planning for you. It makes your life easier when you're able to identify this early on and be able to work with your folks around it. And I hope, and I know this was kind of quick, but I do hope that some of this is interesting enough, and let us know if you need more specific information. Put it in the chat box, and hopefully we'll be able to provide you that information. Thank you so much for being here.
Thank you, Diana, and thank you, everyone. We do realize we're about 3 minutes over time, but we're almost done here, the last few steps of our presentation. If you have a moment, please complete the post-test and evaluation survey that is on the screen. You can either scan the QR code or click the link that has actually been placed in the chat. And now for closing remarks, I will give the floor to Nikki.
Thank you all this afternoon for being here with us. It is at this time that we would like to thank our facilitator for today, our subject matter expert, Diana Padilla. Thank you so much, Dee, for being here today with us. We know that we asked you to take a huge amount of information and make it into 30 minutes in order to accommodate our audience for today. We are very aware of time restraints for the population that we serve. So you will see many more 30-minute presentations. So we hope that you will join us. We are so appreciative that you all took the time to be here with us for this information. And we have many more trainings to come. And our next training will be offered on Thursday, March 29th at 2:00 p.m. Eastern Standard Time, Mental Health 101. You can actually find the registration link placed in the chat box. And if you would like to be included on receiving notifications of our virtual live events, there will also be a link placed in the chat for you to receive text notifications. We want to make this as convenient for our audience as possible. And if you have any suggestions about future virtual event topics or subject areas, we invite you to visit our website at www.nursinghomebehavioralhealth.org to share your ideas. This is truly about the people that we serve, you, nursing facilities. So if you tell us you need something, we are going to meet you at that need regarding substance use disorders and mental health disorders. So thank you all so very much. Take the opportunity to visit our website. Again, that is www.nursinghomebehavioralhealth.org. We truly appreciate each and every one of you for joining us today, and we hope to see you next time. Bye-bye.